because when we have osteoporosis, the important thing is that we do not come into flexion, rounding the spine. So when we do this flow, it sometimes is taught with child's pose, and quite often is taught with child's pose, which does bring more of a flexion into the full flexion into the spine. I'm going to teach this today with puppy dog. And when we do puppy dog with our arms extended and long, we allow the shoulder blades to come onto the back and support the upper thoracic spine and not allow that rounding to come into the back. I recommend that you use a blanket underneath your knees if you have knee issues, not too big of a fold. And then of course, if you have knee issues and you need even more support, you may need a bigger fold. And then this is a bolster, which I highly recommend to have as part of your yoga practice, because it can really help support the body in many ways for many poses. And then when it comes to restorative yoga, which is so yummy and so lovely for self-care and self-love, I recommend trying to get a bolster or finding a way to create a bolster with blankets and pillows. So this is more about moving the spine through flexion and extension, or rather through extension, which is okay for osteo, and the flexion happens here at the hips. So let's not round the spine, let's let the folding of the body occur here, isolating it at the hips. So you're going to begin here in your puppy dog pose, inhale, and then you're going to exhale to come forward. You could either have the bolster there or not. It's going to be your choice. Exhale back, inhale forward, exhale back, inhale forward. Feel what you feel. Keep your arms straight, rolling through the ball and sockets, the shoulders, the hips. You may need to take your arms a little wider. Experiment with what feels best for your body. One more. Inhale forward. Stay here. Don't dump in your shoulders, so be pretty active. Press your hands into the floor. Feel that space as the low ribs are moving away from the top of the thighs. One more breath. And then exhale, bring yourself up. Let's come onto the soles of the feet if you could be here. And if your knees don't like to bend, you can actually come up. Let's take a couple of breaths here to feel what we just did. Feel the movement in the body, feel the work in the body, feel all that release that just occurred.